So the brief background is that we wanted to understand the issues behind poor utilization of maternal and childhood services, despite the fact that the major barriers for accessing services had been removed. Mothers were no longer paying for accessing maternal and childhood health services at rural health facilities. So this study sought to understand the barriers behind the poor utilization through conducting community dialogue with community leaders. These community leaders were purposely selected. Initially, the health facility would give a list of community leaders who were knowledgeable and influential in the community about the issues of maternal and childhood health services. 80 men and 55 women community leaders participated in the study. And from the findings from the community dialogues, 4 key thematic areas emerged from the study, which resulted in poor utilization of services. These are poor accessibility of health services, socio-cultural barriers, lack of information, communication and education material, as well as poor attitude of healthcare providers were cited as the main barriers. Because the study also sought to evaluate the use of community dialogues, we then found out that dialoguing was a good method to inform, educate, and also stimulate collective responsibility towards improving maternal and childhood health services. As we conducted the study, also at the end of the dialogue, the community leaders produced micro plans, which then they were going to follow up in order to improve access and utilization of maternal and childhood services. The major issue was that there were certain specific maternal and child health indicators which were poorly performing despite the services being free. These included vitamin A supplementation to children from 6 months to 59 months. There were also high home deliveries in the selected health facilities. There was also poor antenatal care attendance also among mothers from the selected facilities. And therefore, we needed to really understand the issues behind the poor utilization of maternal and child health services. Mostly on the background now, in Zimbabwe, we have a non-governmental organization which received funding from the World Bank to improve or utilization of maternal and childhood health services. And the program has been running since 2012. But even though the program has been running, still utilization of maternal and childhood health services were poor. The country target for antenatal care services, access to vitamin A is at 90%, but still what we discovered from the selected 4 health facilities where the dialogues were conducted was that utilization of maternal and childhood services were actually below 50%. And then in those facilities also there were high home deliveries, which were above the expected 10% rate. The methods that we used a discussion guide to conduct dialogues with communities, and this dialogue lasted between 30 minutes and 45 minutes. After conducting the dialogue, there were also trained students who were part of the community dialogues. We then sat as a team and compared our complementary notes to check if we all understood the key thematic issues which were also coming from the dialogues. So we also utilized a summary form to capture pertinent information. And then after that, we analyzed the data using content analysis and of course following the steps of transcribing, organizing, categorizing, and coding data. We then triangulated our findings with secondary data just to eliminate potential sources of bias, and also interviewed district nursing officers whom we knew were quite informative and knowledgeable about maternal and child health issues in these specific health facilities. We found out that, like I said in my introduction, the issue of poor accessibility of health services is a major barrier to utilization of maternal and childhood health services. Mainly, it was the issue of unavailability of transport. The mothers, actually, the community leaders mentioned that from the areas where the majority of the population resided, there was poor or transport was unavailable. Say for a mother who wants to deliver, for them to be able to go to the health facility. And those who did not have a transport available in their areas, they would travel more than 15 kilometers to go and access health services. And then also there was an issue of high consumer costs. Even though the results-based financing program provided free health services at the health facility level, the mothers still incurred costs to travel from home to the health facility. And also this was a barrier at another level. And this informed actually post the study on how the program was being reprogrammed. And then there was also an issue of the unavailability of outreach services, especially for vitamin A supplementation, because the mothers were traveling long distances. They actually felt that if these services were complemented by outreach services, it could actually be useful for the mothers to improve utilization of these services. We also found out that there were socio-cultural issues which actually hindered utilization of maternal and child health services. These are religious beliefs. There were some religions in the communities which did not permit the congregants to seek treatment. And there were also other cultural beliefs. The leaders actually mentioned that most mothers believed that once they go to the health facility when their pregnancy is early, it can actually result in bewitchment. So the late bookings were as a result of some of these cultural beliefs. And then also the issue of attitudes of the healthcare provider. The leaders actually mentioned that mothers, when they go to the facility, they were attended late. And in some cases, the healthcare workers were actually rude to the mothers. And this actually discouraged mothers booking at the health facility area. This also discouraged the health facility deliveries. So mothers would actually go to traditional birth attendance to avoid the health facilities due to long waiting hours and also the attitude of the healthcare workers. Another key issue which also emerged was the issue of lack of information and education available on MCA or maternal and childhood services which were being offered by health facilities, especially on vitamin A. The mothers viewed it as just a drop that was being given to a healthy child. They did not have much information about why is it important to have their child receive vitamin A, why is it important also to book early. So the leaders were saying if the communities are provided with adequate information, this could actually improve and raise their awareness in terms of the importance of the children receiving vitamin A and also early bookings and institutional deliveries. Also, there's also a micro-action plan that was also developed at the end of the dialogue. The study had 3 major objectives: to understand the barriers to utilization of maternal and child health services, also evaluate the community dialogue is a method, is it appropriate to discuss community issues, and also develop these micro-action plans after the dialogues were done. So there were key issues which actually emerged from the micro-action plans. What was very useful about these micro-action plans was that the challenges were identified and the various actions were also identified, as well as the timelines to ensure that mothers actually improve their utilization of health services. The major issue on availability of transport, the community leaders, especially the ward councillors, then actually volunteered to conduct a lot of engagement meetings with authorities to be proactive in terms of servicing of their roads, and also mobilize communities so that they could actually start community initiatives in filling gullies and potholes to ensure that other service providers would actually want to come and offer service in their area. Also, the health center committees actually also volunteered to reorganize themselves and collect funds to purchase an ambulance at the health facility, so that at least if there are emergent cases for deliveries, these can be ferried to the referral hospitals as soon as possible. The issue of long distances, again, the nurses in charge also shared information on how they could actually improve the outreach services in their communities. The good thing about this dialogue was that the community leaders were there, and they also actually agreed to provide space for these outreach points, and also provide community workers who would actually help in mobilizing communities, so that once these outreach services and schedule is shared to the communities, then these points are actually attended by the different community members. The issue of social cultural beliefs, mostly because this was more of a community centered issue, the community leaders felt that the village health worker chairpersons were the correct people to tackle this issue. They would then engage the various community leaders, and also engaged the various church organizations who would actually participate in receiving information, especially on the importance of referring the mothers to the health facilities. They discovered that some of the mothers were detained at these different shrines, various shrines, before they even attended the health facilities. And some of these religious leaders would actually provide delivery services to the mothers. On the issue of attitude, nurses' attitude, and lack of information, the health center committees then actually mentioned that they would engage the district health executive, which actually manages health facility staff, on how to work with the health workers, how the health workers can actually be forthcoming, so that mothers do not deliver at home, but would prefer to go to the health facilities. Findings from the study actually show that community dialogues are informative and allow shared decision making. As we can see, there was a micro participatory action plan which was agreed by the community leaders, and this plan was being followed and monitored after the study. And also the participants mentioned that community dialogues are effective in discussing and providing information on health matters, especially when these dialogues were being done. We had a panel also of health workers who were there to answer questions, especially on issues to do with vitamin A, the importance of having an institutional delivery. And as we were understanding the barriers at the same time, there was also information exchange between the health workers and also
Excuse me, Ms. Priscilla.
community leaders.
Excuse me, Ms. Priscilla.